Trauma Chat with L&L takes the complexity of trauma and makes it bite-sized.
Our goal is not to minimize it, but to normalize having the conversations about the experiences that many of us have had without always knowing how to cope.
Trauma recovery is possible. Healing from past hurts or even recent hurts is possible.
And we're both trauma therapists, so let's talk about it. I'm Leticia Fonrose, a therapist, speaker, author, and owner of Holistic Quest Wellness. I'm a licensed clinical social worker and certified EFT practitioner, which stands for Emotional Freedom Technique. And I specialize in supporting individuals and communities by discovering tools, strategies, and insights to have a better relationship with their thoughts and feelings so that they feel more control in their lives.
And I'm Leticia Vaca Williams, a therapist, speaker, and owner of Urban Health Group, Inc. I'm a licensed clinical social worker. I'm certified in brain spotting, certified in EMDR, and I'm an experienced medical social worker. Urban Health Group is a boutique-style concierge for healthcare navigation and mental health support. Our ultimate goal is to empower Black, Indigenous people of color with tools and supports to effectively navigate their health and mental health needs for better wellness. And the whole field of mental health is based off the medical model. Some of it fits and some of it doesn't, right? If there's an issue in the medical model, we say, let's fix it. Where sometimes in therapy, though, you're having a very normal reaction to abnormal circumstances that are totally understandable.
Exactly. And that is something that we hope to normalize on our platform is, some things can't be fixed, and I quote that, right? It's just an ongoing journey that happens over the course of your life. Like there's not going to be an end to growth, because that's really what it is at the end of the day, is like personal growth, right? Whether that's through like overcoming anxiety, overcoming depression, overcoming trauma. There's another myth I feel like that's floating around in social media around like you're supposed to know all of your triggers. And I'm like, it's not really possible to know all of your triggers, because a lot of them happen below your conscious awareness. You can see the color red and not even recognize like that was a trigger for you.
Yeah.
So it's important to know like how you navigate stress in your body.
Yeah.
So it can be messy sometimes.
Yeah. In this thing that I can be fixed, or sometimes it's erased, right? The fact that it happened is terrible. Well, yes, it is. It's always going to be terrible. Like if you experience domestic violence or childhood sexual molestation, that's always going to be a negative experience. But the way that your body experiences it, now that you're no longer there, that's the relief you can get. So I always tell, I'm not in a business of like erasing people's memories. That did happen. You did have a reaction. And it actually is appropriate that you maybe had some acting out, or it was hard to kind of gather yourself. But what happens now when that mode that I've been in is no longer helping me? It's hurting me. And so this fixing of ourselves, or erasure of that don't happen. So we see people do all these kind of unhealthy, maladaptive ways to cope, and it does help you for a little bit, right? Even at the height of COVID, when people were like joking on social media, well, I'm gonna drink, right? It's happy hour so early.
Yeah,
how people were coping. And that might be okay for a little bit of time, or that you might find excessive like marijuana use or excessive recreational drug use. And we know in our country, like there's a huge opioid fentanyl. So we look at what point can you recognize within yourself something is actually unhealthy for you. So there's levels around what is normal, what is abnormal, what is a clinical issue versus it's an issue but it's not clinical, right? Like I can be sad without being in a depressive state.
Exactly, exactly. And even going back to like, the substance use and all of those things, I think a lot of people look for quick fixes. And it's another reason why we need to be on this platform, because that's not the reality for long-term sustainability of a healthy lifestyle, right? Like, yes, like, having a drink or smoking or, even going to the gym sometimes, like could be that quick relief. And if the problem is not solved or you're not working through the challenge that you're having, then you find yourself just kind of escaping and avoiding the discomfort.
Right.
And so, a part of our platform is just normalizing, like, it's not going to look perfect. It's not going to be a quick fix. And it might not even feel easy. It's simple,
It's pretty
but
simple,
it's
but
really
it's gonna be
simple.
hard though.
It's gonna be challenging for
Yeah.
sure.
Yeah.
So that's another thing on social media where people are like, just do this, 4 steps to this, or and it's like, yeah, there are 4 steps, but those 4 steps might take 4 years, you know.
One step may take a couple
Yeah.
years,
Mm-hmm.
especially if you do it unsupported. And there may be 4 years that go by and you take no steps.
Yes.
So we look at what's actually going on with you, and social media is portraying these quick fixes, that I can just follow this person and just get nuggets and gems all day, but your conditions are not changing.
Mm-mm.
It is helpful. I'm not knocking social media because it is normalizing, like, talking about difficult or very personal or challenging things. It has definitely created a platform for people to share, but it also is creating kind of a vicarious trauma where, like,
Mm-hmm.
I'm hearing stuff I don't necessarily want to know about other people. That's overwhelming to me,
Mm-hmm.
so being mindful to protect our own personal mental health needs, that if I'm only locked into these kind of networks, I'm only seeing the issue. I'm not necessarily seeing opportunities for growth and healing.
Exactly. I love that. I love that. I agree 100%. And not only that, like do the research around the people that you're following. Like what is their background? What is their expertise? Where are they getting their information from? Like those things are really important. Because there's a lot of mental health influencers.
Right.
And I think it's great because they're bringing awareness. But also, if you're wanting to get treatment and get long-term sustainable change, it is important to connect with somebody who is a professional.
Right.
Um,
Right. We were talking a little bit earlier about there continues, although there's all these platforms and personalities around advocacies and advocates for mental health, there's still a lot of stigma around seeking treatment, and
mm-hmm,
how our emotional wellness is underrated as a concept that needs attention, right? We think of it as self-care, at least that's how it's portrayed. Mental health is when I'm doing self-care activities, but we don't always look at it as like total care, how it contributes to our overall functioning. And when I worked in the hospital, I was able to see, people with severe injuries or end of life, or they were struggling to manage their diabetes or heart conditions, or even COPD. A lot of times when I was talking with them and providing like brief counseling, there was underlying like depression,
mm-hmm,
underlying mental health stuff that was not being addressed. And part of it, well, my thoughts are the healthcare system could be a little choppy, but you can't just tell you're not taking care of yourself. Well, I'm depressed. I have this diagnosis anyway. No one's actually saying that.
mm-hmm.
They're experiencing it. So mental health doesn't always show up in our mind. Like they're still going to work, still showing up to family events, but it's presenting issues in your physical.
Yes.
Wow. So what are some other ways that you see how unmet mental health needs are presenting for folks?
Yeah. I think a big way that it presents is like people tend to maybe even think about getting support when they're in a crisis,
Mm,
right? It's like, okay, things have hit the fan. I am going crazy, losing my mind, or whatever the case may be. Now I need some support. And mental health is a part of our health in general, right? So it's not just when crisis happen or intervention happen, it is preventative care. So what's your mental health routine every day, every
mm,
week? Those things are not talked about enough as far as it relates to mental health. So it's like once, I'm having a strained relationship at home, or work is not going well, or I'm ruminating on the same thought for 2 weeks and I can't stop. It's like, okay, now I need help.
right.
Which is great to be able to reach out when you notice that you are in crisis. The work that I do with my clients is like, how do we create sustainability so that these crises are few far in between? I'm not saying you're never going to have a crisis, because
Right.
we're
Right.
human, right?
Right.
That's going to happen, but having a crisis every week, like that is not a quality of life. So what do we need to put in place to prevent this from happening? And you're taking care of yourself every day,
Yeah.
not just when you're in crisis.
Yeah. And that's when I hear people, they don't even say that. They're saying, I'm just tired. Like you get
That's
to
a
the
good one.
point where you're running out of ideas. You don't even have the energy, but your heart wants to continue to work on this strained relationship or push through at this job. I'm tired. And so sometimes people wait to the breaking point
Mm-hmm.
to acknowledge how overwhelming, how heavy their circumstances have been. But
Mm-hmm.
now when you're coming to therapy, they come in with like a whole armful backlog and that's okay because our role is to help sort things out and decide what we're going to work on. But there's this way that folks have been operating, and when we think about trauma, I'm always interested in who told you had to carry all this stuff.
Yes.
Why? Just and I was some. You could set it down for a minute, like while we're
Mm-hmm.
here, you could set
Mm-hmm.
all that down, and if at the end of our session you want to pick it back up, that's on you. But you can set
Mm-hmm.
it down into the concept that I can lay down some of my emotional burdens,
Yes.
set it down,
Yep.
for a moment. A lot of it comes from the stories, not even the stories, but what we witnessed in our families
Mm-hmm.
about how people work, how people show up. And I know in my own family, like the matriarchs held
Oh
it
yeah.
down.
Yes. Mm-hmm. Mm-hmm.
And I'm thinking, it's hard enough to hold it down for me. Grandma hold
Yeah.
it down. So we think of, what I
This-
know now is, intergenerational trauma around. That's my role, is to show my love by taking on everyone's stuff.
Being the strong one, right? Having to have it all together. And not even that, but like, like there's no room for feelings or emotions or thoughts. It's like you just have to push through because you are the matriarch. You are the glue that helps the family stay together.
Right.
So if you create room and space for these things, at least back in the day, like who's gonna help out, right?
Right.
Who's gonna keep it together?
Mm-hmm.
Um, and then also back then, we are still unpacking stigma today. Imagine 10, 20 years ago,
Right.
especially with people of color, like accessing support and resources to be able to navigate these things. The stigma was
Mm-hmm.
even bigger then. So yes, no, for sure. I hear you with that
Yeah.
100%.
And even for men who come into my practice, sometimes not even having the language, the space to express what's going on with them emotionally.
Mm-hmm.
And I can't say, who am I going to talk to, right? How can I, who would care? How do I even let the words hit the air about what's going on with me? And we're seeing, um, at least if you just look at celebrities, because that's what's shared is, people choosing to die by suicide, right?
Mm-hmm.
Deciding that the weight of everything is too overwhelming. And everyone
Yes,
has their own reasons that things could, I can get some relief if I was no longer here, right? A lot of times when
exactly.
people are looking for a way out, they're looking for relief. They're not trying to hurt anyone, but we see it and we're alarmed when it's successful people.
Mm-hmm. Mm-hmm.
People we deem as successful. Man, if they can't, well, it's happening to a lot of people.
Yeah. And I think that I might be speaking kind of out the side of my neck, but might be a strategy for people who are high achievers or who are successful because they're kind of just stuffing things, right? Like, well, there's nothing that I can do about it. It's already done. So I just have to keep pushing, keep moving, move forward. I definitely see that a lot in my practice with people who it's like, what's done is done.
Yeah.
And my thought process is, I don't know yet, and I'm kind of assessing now after that is said, is like, have you numbed this out or did you fully process this?
Yeah.
Right? Because one of the coping strategies that we've noticed is being able to shut down or disassociate with the trauma, and you're just kind of numb to everything, to where if I ask you if you had a feeling, you legit don't have one. Because listen, we just unpacked lots of good stuff.
Please note this is not a replacement for therapy, but we do encourage you to use Trauma Chat with L&L podcast as a part of your wellness plan.
Because we want you to have the knowledge you need to take the next steps.
And if any of this resonates with you and you'd like to discover how to move from surviving to thriving, please go to my website at urbanhealthgroupinc.org.
And or my website, holisticquestwellness.co, to connect with a licensed therapist where we provide a variety of mental health services.
Our links are listed below. We'll see you next Monday.